Hello, my name is Jeff Barton, and today I'm going to be performing a home assessment, specifically focusing on the bedroom for a person that has experienced a stroke or CVA, resultant left side hemiparesis, and they are currently using a hemi walker, which is stationed down here. The first thing that we're going to do is look at the entryway into the bedroom. And as you can see, here we have a couple of door handles coming into the bedroom. If I were to be utilizing the hemi walker here, this doorway is not sufficiently wide enough to accommodate my body width as well as the assistive device here. So what we would need to do, conveniently enough, in our situation, we're able to open up this secondary door. The single door is only about 22 inches wide without this one. When you open up the second one, it becomes about 46 inches wide. And as you can see, that's more than enough to accommodate myself and the assistive device. So very easily you can move through there. The next thing we would look at is the fact that we have a threshold down here. So there is a divider between the hardwood floor and the carpeting. If you're ambulating with an assistive device, this uneven surface with somebody with a stroke, they may have diminished sensation. They also probably have a little bit of weakness in the left side of their body, the hemiparesis. So this would be an obstacle that we would likely want to remove for safety's sake. So we would want a smoother, more level transition from the two rooms, from the hardwood onto the carpet. And in fact, that brings us into the room and the fact that we do have carpet in here. The carpet in and of itself is also a safety concern. Since we put this hardwood floor in ourselves, if I were in a situation where myself or somebody that lived in this place, this was their bedroom, I would likely want to remove the carpet, put down a hardwood floor. That way you have no discrepancy between the two surfaces. It's all just going to be one flat level surface. That's going to be the safest and less prone for slips, falls, tripping. The carpet allows them less perception. So, if they have a little bit of trouble walking, that carpet's going to be a safety concern for them. Now, the next thing that we're going to look at once we get into the bedroom is the bed itself. The bed should be at a sufficient height to allow for easy transfers on and off the bed. And that means if you're a 4'10" little old lady, you're going to want it a little bit lower than if you're a 6'10" basketball player. So what we're looking for here is a firm surface. You don't want it too saggy. And the other thing that you want is that it allows you to come up easily. If this were this height, imagine how much extra energy it would take for me to push myself all the way up from the seated position to a standing position. Conversely, if it were this high, I would have to propel myself up onto the bed, which again would not be an ideal situation. So it should be at a height where if you're sitting, you can have your feet firmly on the floor while being able to easily stand up and not have to use an excessive amount of energy coming off the bed or going down onto the bed. Now, with the left-sided weakness from somebody with the stroke that we experienced, typically you want to transfer to your strong side. So in this type of an environment as we're laid out right now, I would want to transfer into the right side. I could also use this leg lifter. I'm using a belt, but occupational therapy has what's called a leg lifter to assist with me in my transition into the bed. So I could put this leg up, use the leg lifter to bring the secondary, the weak leg up, and there I am, up all safe. You can also, if you have the strength and dexterity to do it, you can just use your stronger leg and use that leg to curl under and lift that bed or the leg up onto the bed. Once you're up, it's going to be a good idea to have a pillow so you don't have that arm just lagging and falling down. So it's nice to have something under that shoulder to keep the arm up in a elevated position. So now that we're on the bed, we'll take a look over here at the nightstand. I have applied the blue electrical tape to the flashlight, to the lamp, and you can imagine if there was a cell phone here. Now, the blue electrical tape can also simulate glow-in-the-dark tape. That way you can find things in the dark, because if anything happens, you're going to want to have easy access to things like a flashlight, be able to turn the light on in a hurry, be able to access a telephone in case you need to call family, friends in case of emergency. So, and this is a good height for me to reach if I'm sitting or laying on the bed. You also, when you're looking at the bed, you want to make sure that it is not able to move easily. So whether you raise it up and put it on blocks so that it cannot be moved, or put non-skid pads underneath the wheels or the legs of the bed, it needs to be in a position where if I bump into it or I sit on it, it's not capable of moving. That in and of itself is another safety risk. If you look at the dressers, clothes in the dressers should be put in the easiest available places to reach. So this isn't an extremely high dresser here. I would think most of your stuff your clothing, socks, pants, shirts, whatever you use most frequently should be in these top two drawers. Other things that are used more infrequently, you would put down here. If things are out of season or not used very often, those are going to go down in the bottom drawers. Same with this dresser over here. And I've kind of illustrated that with the blue electrical tape on it as well. These top drawers going to be the most optimal to put things that are frequently used in. See, I can open this very, very easily. Same with this one. This one I've got to bend down. Again, if I have weakness in that left leg or balance, proprioceptive issues, it could facilitate a fall. That's not what we want. If things are on the floor, you can always use something like this little reacher here. So if I were to drop a sock or a shirt, I can just bend down with this, pick it up, and there it is for me. I can just grab it like that instead of having to bend all the way down and get it with my hands. So that's another device that you can use to become more safe. We'll also look at closets. Closets similar to the dresser. Things should be put around shoulder to waist height, for the ease of and convenience of being able to be reached easily. So everything over here, that's hanging, I can easily see that, grab what I need. Shoes that are worn frequently should be placed on these racks, not these down here. And clothes, that are used frequently and not hung, should be on these top levels. Things that are not used very often are going to be up on the shelf up there. Same with this side. It's also arranged in a fashion that most things I reach easily here, I use more often. Shorts, jeans that I use regularly are here. Other things that I use less frequently are down there. And laundry is down at the bottom as well. So, as we talked about earlier, some of the things with stroke that you may experience, are weakness in one side. You also, may have like an assistive device, like an ankle-foot orthosis. And that's going to be something that you have to take into account with ambulation, and wear a shoe if that's something that you have on. Sometimes with strokes as well, you'll see neglect to the right or left, depending on which side of the brain was affected. And so basically neglect is when, part of your visual field, you don't really recognize it. So you don't see anything from the midline to the right or midline to the left. If that were the case here, I've talked to many therapists that would say, okay, put everything on the right, that way they can see it, it's there readily available for them. Others, though, might say, like we do in therapy, and try to make them scan to that neglected side so that they're aware of it more. Oftentimes you'll have family and friends stand on that left side in this case that they neglect, and talk to them to make them visually scan over there and make them continuously aware of it. That's something else you might do in this case, is to put some of the stuff on the right, other stuff on the left. That way they have to scan over here to the left and become more aware of their deficit in field of vision to the left. These doors are pretty conducive to somebody with a little bit of weakness in their left hand. Instead of having to turn a doorknob and open it all the way out like this, these doors are very light, they slide. I can open this one like this one like that, and here I have all this open area to view. So these doors are very good as compared to maybe a door handle or knob. And that is another thing that we definitely need to discuss, especially since I have, during ambulation, I'm walking with this Hemi walker in my right hand. If I have weakness in this hand, or if I have the Give More sling that we'll look at here in a moment, it's going to be difficult for me possibly to turn a doorknob with that diminished strength in that left hand. So in that situation, it might be wise to put a door handle instead of a knob. That way it can just be pressed down and you can push the door out. So a handle instead of a knob might be advantageous in a situation like this. And as I talked about, we'll look at the Give More sling here, and this is just something that they can apply and wear to prohibit a little bit of subluxation of the shoulder, so you don't have the falling down of the shoulder. This gives them a little bit of feedback and keeps their arm in more of a normal position. So they're not having it dangle down towards the sides and be weak. Okay, we'll take that off now. One other issue that we can look at is the entryway into the bathroom. Much like the entryway into the house or into the bedroom from the living area, this one is also very narrow. Ideally, we'd like to have it actually open out away from the bathroom, because if they were to slip and fall in the bathroom and be wedged against the door, if you don't have a secondary door, that could be an issue of trying to get in and get that injured patient out. So ideally, we'd like to have it open out. In this configuration of the room, that's not really feasible. One thing you could do, to widen out the door is, make less of a closet and just, make this doorway wider like that. You could also do the same on this side potentially, if the other room behind here allows that. You could also potentially make a pocket door that just slides. That also might be easier for the person to push open, as opposed to using the door handle. And I think that's it. Have a good day.